So now common term knee replacement, every household has this knowledge about knee replacement. And people think what robotic knee replacement is new in technology, what it's going to do. And people will have the doubts whether robo will do or doctor will do in robotic knee replacement. Robotic knee replacement is nothing but it's a third arm, another hand to the surgeon while performing the surgery. It is absolutely surgeon will do the surgery, not the robo will do the surgery. It's not completely automated or given permission to robo to do the surgery and surgeon will sit somewhere. It's not like that. So we'll give some information of the patient to the computer. Computer will generate according to the patient morphology, means the architecture of the knee. It will give some values to the computer. Then it will generate a picture what type of the sizes will fit to that, how much balance, means the ligament release or muscle stretch will be there, how much we need to make it perfect, how much we need to cut to make it perfect, and it helps in less cuts and less tissue release. Because of that, patient will have less pain after surgery, and there is a shake in our hands, but the robot doesn't have a shake while cutting the bone. So it perfectly matches the implant what we put, it perfectly matches to the bone architecture so that the longevity will be increased. That is the idea of the robo. So robo doesn't do the surgery, robo is an extra hand to the surgeon. By that the precision will increase so that the longevity and less pain to the patient and early recovery will be there. So what is the difference between the conventional knee replacement and robotic knee replacement? People will ask what are the advantages as we discussed. In conventional knee replacements, for even short or long person or heavy or lean person, we will take certain measurements according to design of the implant or some landmarks. These are landmarks are almost for every person. It's not like a difference in the landmarks will be there. So because of that, there are certain implants we need to match our knee according to the implants design. So in conventional we'll do that. Even conventional has given a good results from past 20 years. But according to robo takes its own bony architecture of particular patient. So there will be multiple options, multiple implants will be there. So it's better, we can give a better tailor fit to the patient in a robotic knee surgery rather than a conventional thing. So by giving a tailor fit made, the recovery will be faster. That is what robo has doing it. In conventional also, we need to match the bone according to specific implants, and the landmarks are all same, irrespective of architecture of any human. So that's where the difference will be there in the healing and everything. So conventional also surgeon has to do, in robo also surgeon will only do, but taking the assistance of robo where the recovery will be enhanced. Robotic is not a harmful surgery. As we discussed, robo is an arm to the surgeon. Surgeon only perform the surgery. Robo doesn't have any independence to do that, but robotic is a technology, comes with an extra cost to the patient. That's the difference. But added advantage is also there. But future, if you consider, a lot of artificial intelligence in every field is there. Even in the science also, this will percolate in the future. Robots will be the future for future generation also. So many people will ask, am I suited for robotic surgery or conventional? It is not the choice of the patient or the doctor. Anyone can go for a robotic knee replacement. Initially, robo or navigation are very good when they are having a metal in their body, which we can't do routine surgery like a conventional surgery. If they had any fracture previously, the bone is bent, which is angled, which is conventional cannot be done because based on certain landmarks, robotic or navigation is an advantage to that. But in robotic, every person can get a robotic surgery. There is no contraindication as such. Robotic doesn't harm anything. So the indications is the patient choice and the technology, taking the technology advantages. So there is no harm in doing the robotic surgery for a normal knee replacement or normal routine arthritis also. And most of the people will have a fear after surgery, the pain process. So actually this pain comes from the muscles. it's not from the bone. Actually, the pain before surgery is different, after surgery is different. It is not the same pain. And it is a myth that patient doesn't have a pain after surgery. Will have pain. Depends upon the personality, they will walk on the same day or next day. It is not a forcible thing. If the pain is less for few people, they can attempt it on the same day. If the pain is there, some people will do next day. So whatever it is, the physiotherapy is mandatory for each and every patient. After surgery, the exercising the muscles which are not done for long past. Most of the people stop walking because of pain. All the muscles will sink inside. They have a less strength. After surgery, we'll make it mandatory to do the exercises on the insulted muscle. Means we need to cut the muscle to do a surgery. So on the insulted muscle, if you do exercises, some amount of pain will be there. The muscle pains, it's like going to gym and exercising, the body pains will be there for 2 to 3 weeks. It's a similar pain because the people never exercised before, or people who exercised will have, the process is easy. For not exercised people, they will have some pain to some extent. If they tolerate well, but they have to move out of the bed, all the muscles will move. Sitting and getting up, usually they have a pain rather than walking, because the previous pain while walking will go after surgery. They won't appreciate that. They appreciate the new surgical pain and exercise pain. If they are strong enough before surgery, doing the exercise physiotherapy, they will walk in and walk out very simple. But the people who are not walking for long, so much of time they spent in the wheelchair or on the bed and not moving at all outside the house also, they'll have weak muscles. They need to spend more time on physiotherapy getting the muscle strength back. But post-operative, the physiotherapy is more important. If you do proper physiotherapy, get the muscle strength back as early as possible. So you can walk faster, the steps will be good, no tumbling while walking will be there. If you have energy, you can climb stairs also after the surgery. So physiotherapy plays vital part even before surgery also, not only after surgery. So robotic surgery is in place in India since 3 to 4 years. All the world is also doing. It is a safer surgery. Advantage with the surgery is, as already discussed, is a precision. The longevity will be more because the implant properly placed according to their own architecture, like a tailor-made implant, and the balancing is perfect. And we are giving, it's like a native knee to the patient, not to the well-designed for everyone. So what is native for particular person is not correcting every angle to that angle what the patient required. So that is called tailor-made knee or tailor-made kinematic alignment in our terms. So particular angle, every patient will have a different angle of walking, different angle of knee. So that angle can be calculated properly in the robotic, and it's mostly a safer surgery, and the recovery will be good in the robotic knee replacement, and there is no harm in getting the robotic knee replacement.